Dr. Hardy Limeback is the leading expert on fluoride in Canada and a professor of preventive dentistry. He was highly regarded until his research and the research of others confirmed that fluoride only works topically to prevent tooth decay. Hardy was threatened with termination from his position as a professor in the dental school when his research was made known, and he was in fact fired by the Canadian Dental Association from his position recommending fluoridation. But he's a man of integrity and he stood by his research, and now the whole world agrees with him. Listen as Paul Connett, professor of chemistry, and Hardy Limeback discuss the problems of having integrity in today's world.
In April of 1999, one of Canada's leading dental researchers began calling for an end to water fluoridation. That researcher was Dr. Hardy Limeback, president of the Canadian Association of Dental Research and head of preventive dentistry at the University of Toronto.
And I guess I'm here in Mississauga because here we have in yourself a practicing dentist, an expert advisor to the Canadian Dental Association, and president of the Canadian Association for Dental Research, and the chairman, head of the Department of Preventive Dentistry at Toronto. But about a year ago, the name made headlines in Canada and beyond when you came out and said you were opposed to fluoridation. What led up to that?
Basically, it started in 1992 when I helped a colleague of mine, Chris Clark, who's a public health dentist at University of British Columbia. Together we organized a workshop to look at the issue of whether or not fluoride supplements should be banned for children who are susceptible for dental fluorosis.
What is a supplement? What's a fluoride?
Fluoride supplement is a tablet of fluoride that gives you the equivalent of a daily dose of fluoridated water. It's a dose that we had always assumed was necessary to protect kids in non-fluoridated areas.
So this would be a tablet that they would swallow?
Yes, or chew and swallow.
Chew and swallow, yeah. And what was your conclusion about the benefit of those supplements?
At the end of the conference, we had experts from all over the States and Canada come together. We came up with a new schedule saying basically, let's ban fluoride supplements for kids under the age of 3 because it was causing dental fluorosis. And it wasn't providing that much of a benefit at all.
Now, what was it then that took you from opposing supplements before the age of 3 to opposing having fluoride in the drinking water?
A number of events occurred. First, I was asked to reorganize another convention or conference on fluoride supplements because the organizations couldn't agree. So we convened again after 5 years in 1997. I invited a number of experts from all over the world, and we had a new conference on fluoride supplements. And during that time, I reviewed the literature as well and discovered that there really wasn't any evidence that fluoride swallowing does any good. In other words, systemic fluoride has very little to do with protecting teeth. It's the contact of the fluoride with the teeth after they appear in the oral cavity, after they erupt, that provides the benefit. And that's when I decided that, wait a minute, we're now using fluoridated water as a drug. We're ingesting it. It really should be used as a mouthwash. We shouldn't be using it to swallow and expose our kids to systemic fluoride.
Now, how many dental researchers around the world agree with you that the benefits of fluoride are come from applying the fluoride directly to the tooth rather than through the whole body?
I would say the majority of dental researchers who are knowledgeable about fluoride, karyology, the mechanisms of how fluoride prevents dental decay, the majority would agree that it's a topical effect.
Well, tell us more about industrial grade fluoride being used for the water supply. Tell us more about that.
Well, I had always assumed that the fluoride that we're using to fluoridate the water supply was pharmaceutical grade sodium fluoride. Then I found out that the majority of the fluoride that's used in fluoridating water supplies in Canada, I got a federal government document documenting it. The majority of it is sodium or hydrofluorosilicylic acid or sodium silicates, fluorosilicates, and these are added to the water supply to produce 1 part per million fluoride in the water. They dilute this stuff down to 1 part per million. Apparently this dilutes all the contaminants that are in there down to levels that are allowed by the EPA. George Glasser showed me a list of all the contaminants in one of the articles he wrote, and I could not believe that we were actually dumping lead and arsenic and even radium, which is produced in the process of making this pollutant. From what I understand, the pollutant is recovered from the smokestack scrubbers in the phosphate fertilizer industry, and it's very rich in fluoride, very toxic, but of course when you dilute it into the water supply it goes down to 1 part per million and supposedly is quite safe. My concern is that we're building up the contaminants in our system. We know that lead accumulates in soft tissues, the brain and bone. We know that actually lead accumulating in teeth make the teeth more susceptible to dental decay. My concern is also the radium contaminants that are found in hydrofluorosilicylic acid. This is known now from the phosphate fertilizer industry that when you make phosphate fertilizer, you release some of the radium from the earth, and this now gets recovered in this industrial grade fluoride that they recover from the smokestacks. They're putting this stuff in our water. And then I found an article saying that radium is the source or one of the main reasons why we have osteosarcoma in Canadian children, an article written by Finkelstein showing the connection between radium in the water and osteosarcoma in children.
How many dentists in Canada do you think are aware that this material, this fluoride that is put into the drinking water, actually is this industrial hazardous waste? Do you think most of them are aware or unaware?
Most. If the only person teaching preventive dentistry didn't know about it, do you think anybody else would know? No, I don't think even a single dentist knew until it started becoming more of an open issue because of the anti-fluoridationists.
When you talk to other dentists and they hear about this being an industrial waste product, does it faze them at all? Or what's the reaction?
The first reaction is prove it.
Yeah. They don't believe it.
They don't believe it.
No. What is dental fluorosis and what causes it?
Dental fluorosis is simply the malformation of dental enamel. And actually, dental fluorosis has affected not only the enamel but also the dentin. The dentin is the inside layer of the tooth. The surface layer is the enamel, and that's what we see. We see white spots on kids' teeth, and that's what we call dental fluorosis. The way it forms, basically, is that the fluoride interferes with the development of the tooth. I did 10 years worth of research in my laboratory studying tooth development, so I know how teeth develop. And Pamden Beston and a few others have been looking at the effects of fluoride on tooth development. And we now believe that there are several mechanisms involved. Fluoride could be inhibiting the enzymes, the serine proteinases that are degrading the final traces of proteins that are left behind in the teeth. The proteins, if they're left behind on the surface of the enamel, will take up space, and it won't allow the crystals to grow to this beautiful, shiny luster that you see normal enamel presents itself. You see these white spots or splotches or lines. In more severe fluorosis, you actually see the surface layer flaking off. You see brown spots, the classical Colorado brown stain. We're now seeing that in North America, in fluorosis area, in areas of fluoridated cities where kids are adding to the fluoride exposure with toothpaste. We're actually getting brown stain, the Colorado brown stain, in healthy kids. Now, it may not be a big concern to them, but The current concern I have, obviously, is that they've got too much fluoride in their system anyway.
Well, that's actually my next question, because certainly in America, the various government agencies now dismiss dental fluorosis as a cosmetic effect, that it's, polish it off or do something with it, and it hasn't done any harm to the person. Could you address that question? Is it just a cosmetic effect? Should we be concerned about dental fluorosis for other reasons?
Well, number one, simply a cosmetic effect is a brush off. What basically they're saying is that we're willing to accept a certain amount of cosmetic problems to prevent decay. Well, if the fluoridation isn't preventing decay anymore, and there's now plenty of evidence in the last 5 years that it's not preventing decay anymore, then the fluorosis that's being produced is now being treated for many different, in many different ways. It's being treated by surface polishing, by bleaching, by porcelain veneers. If you actually estimate how much work is being done on kids with dental fluorosis, we're treating way more teeth for the problem of dental fluorosis than we would treat if there was a marginal increase in dental decay from taking fluoride out of the water. Most of the studies now show that the fluoridated cities have twice the incidence of dental fluorosis, and yet the decay rate is no different. Number two is that the fluoride is accumulating in these people. And I've got lots of evidence to show you that even if you stop the fluoride exposure at a very early age, the kids still get fluorosis in their back teeth because the bone is loaded with fluoride. Their system develops or picks up so much fluoride from the overexposure from the water and the toothpaste and other sources from the diet that the bone has too much fluoride. The bone is the source of the fluoride that causes the dental fluorosis. Now, because they have so much fluoride in the bone, we have more concerns about tooth development, delayed tooth eruption, malocclusion, possible bone fracture, premature skeletal development or maturation. There are many concerns now that are appearing from research that fluoride in kids in their bone system is not good. Add to that the risk for osteosarcoma.
Explain what osteosarcoma is.
Bone cancer. Now, I have a serious concern about bone cancer. We're starting to see some publications now that links fluoridated cities with bone cancer. There may be a number of explanations for this. We now know that fluoride reduces testosterone. There may be a connection between this lowering of testosterone and osteosarcoma in young males. I have a concern because nobody has yet measured the amount of fluoride that the bone cells are exposed to when they're turning bone over. If kids have higher fluoride levels in their bone and their bone cells are exposed to those higher fluoride levels, we know from in vitro studies in test tubes and in culture, that fluoride at higher concentrations are cytotoxic, that they cause damage, they can cause cancer, they can cause, these higher levels can cause all kinds of damage to the cell. So these bone cells are being exposed to likely higher levels than normal. And nobody has yet measured right locally, right next to the cell, how much fluoride these cells are being exposed to.
Tell us about your study where you looked at the levels of fluoride in the bones of Montreal people and the bones of people in Toronto. Explain where this study came from and what you found.
I got interested in the fluoride accumulation in bone, and that's one of the reasons I was concerned about water fluoridation. When I discovered that you didn't need to swallow fluoride to make it work to prevent dental decay, I was concerned that people were accumulating fluoride in bone, in kids and elderly patients. At the time that all of these epidemiological studies were being published, where there's an increased risk for hip fractures. Danielson studies, Jacobs studies. These were studies that were starting to raise some concern in the medical community that perhaps fluoride could be causing some harm, some increased risk for bone fracture. So we set out to actually prove that 1 part per million wasn't really that detrimental, that it wasn't affecting the bones the way that some of these studies were suggesting. And that's how we actually got funded. We set out to prove that it was safe. Whether or not that's why we got funded, I mean, that's irrelevant. But the way we designed the experiment was simply to collect hip bones from people that were donating their hips during total hip implant surgery, compare the bone samples that we retrieved from people in Montreal, where Montreal is not fluoridated, never has been fluoridated, compare that to the Torontonians, Mount Sinai Hospital. We now have compared about 60 samples. It turns out that the Montreal bone samples have a very small variation in terms of their fluoride content and hover around 200 parts per million. The variation in the Torontonian hip samples is tremendous. It varies from 200 up to 2,500 parts per million. We're now looking at just looking at one disease entity, osteoarthritis, factoring in all of the age effects, etc., and not even looking at Toronto versus Montreal, just simply looking at the fluoride content. Okay. Now we have done that. What we have done now is to look at the fluoride content in the same type of bone, and we've discovered actually, or Debbie, who is the PhD student, Debbie Chashra, has discovered that there's a direct correlation between the fluoride content and the architecture of the bone. In other words, fluoride just from water fluoridation exposure, because we presume that the Montrealers and Torontonians have had the same amount of toothpaste exposure. Because in Canada, fluoridated toothpaste was introduced in the same time. We now believe that the little bit of fluoride that's been incorporated into their bone has affected their architecture. Now, whether that's positive or negative, we haven't got enough data yet to show. And the abstracts that we've published so far at the international meetings basically report these findings, that there are differences between Toronto and Montreal, that we are seeing effect of fluoridated water on the architecture of the bone. Whether or not this makes the bone slightly stronger or slightly weaker, we don't know yet. We do know from animal studies that the strength of the bone actually starts to decline the more fluoride you have in the bone. The fluoride makes the bone more brittle because the crystals are packed tighter, and these crystals actually make the bone like a crystal, like a more easily fractured crystal, and therefore a bone that's rich in fluorapatite or fluoride will break more easily. It's more brittle.
And that would appear to be consistent with these 8 studies on hip fracture.
Yeah. Well, the increase in fluoride that these people in the States have been exposed to from just water fluoridation may have contributed to the brittleness of their bone. Because the longer you live, obviously, the more fluoride you accumulate into your bone. And if you build up enough fluoride in your bone from the fluoride in the water, you may end up with bone that's slightly more brittle than average. And of course, we're concerned about hip fractures because that's a huge cost to the healthcare system. Studies show that it's devastating to these people, especially the old ladies, mostly women that are affected by this, end up in wheelchairs, and some don't live through the ordeal. They end up in nursing homes. There's been a study now saying that women would rather die than have a hip fracture because of the prospect of being in a nursing home in a wheelchair afterwards. So this is a huge issue that we should be addressing, and we should be looking very carefully at what we're doing to our bodies, everybody's body. So far, Torontonians have only been exposed for 30 or 35 years to fluoridated water. What's going to happen in 60 years? We're seeing patients with 2,500 parts per million fluoride in their bone. You don't see that in Montreal. So what's going to happen 30 years from now when people are 70 years old with 60 years of fluoridated water exposure? If we continue to expose our population to the level of fluoride that they're exposed to now, there's no question in my mind that we're going to see bone problems, severe bone problems, further down the road, 30 years from now. No question about it.
What about this notion of things around the bone? I guess arthritis, the joints. What is this concern? Could fluoride be interfering with the materials around the bone?
It's well known in the endemic fluorosis areas that the first sign of skeletal fluorosis is aching joints. Fluoride deposits actually in the joints, in the soft parts of the joints, the tendons and the cartilage. And that fluoride deposition results in real achy joints. Nobody, to my knowledge, has yet looked carefully at fluoridated cities or fluoridated populations and looked at the symptoms of arthritis to determine whether or not fluoride is contributing to this endemic or possibly epidemic of arthritis that we have in North America.
Could you give us any other concerns that you have? We talked about teeth and we talked about bones. What about beyond bones?
I'm quite concerned because I'm now learning the chemistry behind fluoride mechanisms and its toxicology. And it's quite possible that fluoride, even at low levels, could affect essential mechanisms such as the cyclic AMP second messenger. Fluoride is a known activator of G protein. And we figure, or some people figure, that fluoride could be affecting all kinds of cellular metabolism through this G protein mechanism. I'm concerned about the effect of fluoride on thyroid tissue. I'm concerned about the effect of fluoride on a number of other tissues. We've learned now that it accumulates in the pineal gland, that it may be affecting melatonin production. I'm concerned about reproductive organs and its effect on reproductive organs. There's lots of animal studies to show that at higher doses it's devastating to the animal's reproductive systems. So, you know, there are some studies that are coming out now looking at human beings in, you know, fluoridated cities where there's been 30, 40, 50 years of water fluoridation. We should be doing studies. We should be carefully looking at the effects of fluoride level exposures and the soft tissue effects.
How's the dental community responded to this latest research and the things that you've mentioned, the pineal gland and the G proteins and the other studies that you mentioned?
I can tell you that there's nothing in the literature that they would have read about the toxicology of fluoride. The journal Fluoride is not even in our dental library. I've now made sure, thanks to the generosity of the International Society for Fluoride Research, they're going to send us the journal back issues to put in our library. The dental community has no idea of the toxicology behind fluoride. The environmental issues is news to them. We really have to do our job to educate the dental community on the possible harmful effects of fluoride.
But we often get either dentists or representatives of the American Dental Association going in front of the public saying there is no debate, there is no scientific debate, there is no evidence of any harmful effects. Where are these statements coming from?
It's based on years and years of circular arguments. You know, when 30 years ago they decided to do reviews of the safety of fluoride, they didn't do the research, they didn't look for the harmful effects, therefore they didn't exist. The harmful effects that didn't exist. It's a circular argument. So they're ignoring more recent data that's coming up now with evidence that it may be harmful in even smaller doses that we had assumed. And they keep coming back to the basic argument that it's safe because we don't see any evidence of harm.
Just about nearly 2 years ago, I had the enormous pleasure to interview the late Dr. John Cahoon in New Zealand. And when we got to the topic of osteosarcoma, he said that he knew parents of children who died from osteosarcoma. And he said, he asked the rhetorical question, how many tooth surfaces saved could justify the loss of one child to osteosarcoma, if indeed that was caused by fluoride? Let me ask you the same question. I mean, how many teeth saved would justify some of the health effects that we may be getting from fluoride?
Well, I think the health care system, the people responsible for the healthcare system should look at the total risk benefit and make a decision. If they actually start making estimates on the cost to the healthcare system, even if there, is an underestimate of the hip fractures, if there's an underestimate of the bone cancers, if there's underestimate of the hypothyroidism resulting from fluoride interference with iodine and thyroid function, an underestimation of the reproductive effects. If you even make those calculations and add that to the equation of dental fluorosis, it's quite clear that the benefits do not outweigh the risks. The risks are far too high. If I was to provide fluoride to a patient in this dental chair and not inform them about the risks involved in swallowing this fluoride, if they take this fluoride toothpaste home, now there's warning labels on the toothpaste, but if I give a special formulation to patients and I say, take this home and use it, it's going to prevent dental decay. If I don't provide warnings and discuss the precautions and the harmful side effects that might occur when you swallow this stuff, I could be sued in civil law, in a civil law court for not getting informed consent. Cities have never obtained informed consent from their residents after putting or before putting fluoride in the water supply.
Why is it difficult to get people, dentists, doctors and others, to even look at this issue?
I think because the national governmental organizations have publicly stated they want fluoride in the water to protect people from dental disease. You have to completely turn around 180 degrees organizations like the Center for Disease Control in Atlanta, the American Dental Association, the National Institute for Dental and Craniofacial Research, the NIDCR, which is a institute from the National Institute of Health. The public health associations recommend fluoride in the water. Everybody still recommends fluoride in the water. We have to eat away at each and every single organization and convince them that they're in the wrong position, that it can no longer be supported, possibly even legally. If there's enough evidence of damage, we may be in a situation to encourage people to speak out and use legal means to stop fluoridation. Because if they're being damaged without informed consent, without providing informed consent, they have a good legal basis to start a class action lawsuit. Now, I don't want to take that approach. I think education is probably the best approach. But unless they change their minds in the next few years, based on the current evidence, I think it's time for litigation. One of the recommendations I've made is because we now know that it doesn't need to be swallowed, that the public has to be informed. Again, informed consent. They should be told that it doesn't work by swallowing it.